All right, what's up, crew? We got Dr. Emily in the house, and it's Friday afternoon. She's worked hard. I've worked hard. Saw a lot of patients this week. All kinds of conditions: neck problems, back problems, shoulder problems, hips, knees, ankles, you name it, we fix it, right? So, myself, Dr. Emily, staff, we all get worked on generally weekly, which is really awesome because we're kind of in this lifestyle of movement and chiropractic and nutrition and all the good stuff that helps us to feel really good, but we still get stressed throughout the week. We have demanding jobs where we're working on people and our bodies get beat up, so we give ourselves the same care that we give to all of our patients, right? So we're going through and just kind of palpating Dr. Emily's mid-back. She's got some tension over on the left trap, left shoulder blade, a little bit lower down at the right side, and checking some shoulder movement here. Right shoulder moves well today. Left shoulder is all clunky. If you can hear it, there's a nice big click in there, and that's telling me that this little glenohumeral joint, the little shoulder joint, is a little too compressed and things are rubbing too tightly, and that kind of goes hand in hand with this big knot that she's got in her left shoulder here. Really everything's just kind of like bunched up. So we're going to do a little muscle work up in her neck, a little muscle work in her back, then we'll get into the adjustment. All right, so a little myofascial release, or what we call like pin and stretch technique. In the office we just say muscle work. A little muscle work helps. Look down for me. Look up. Helps us to identify where sticky joint spots are, sticky muscle spots are, or sticky spots within the joints and the muscles. A little muscle work helps us to relieve or reduce, sometimes totally eliminate those sticky spots, and allows us to get the vertebrae, or any joint for that matter, the vertebral joints, the shoulder joints, allows the adjustment to go a little easier, and it feels really good for the patients. It feels really good for Dr. Emily. And she's got a little bit of tension up on the upper right side of her neck that we're just helping to flush out here. But most of it's on this left side. All right. Look up, down, down. And you'll see in different videos, sometimes we do what we call an inferior to superior, or a down to up muscle stripping move, or myofascial release move. And about halfway through, we'll change that to a up to down movement. And man, she's got all kinds of not so fun stuff going on over on the left side of the neck. Look up, look down straight for me. Look up, look down straight. Look up, look down straight. Look up, look down. Look up, look down. Look up, look down. I'm gonna pull this over a little bit, is that okay?
Yeah.
All right, so we're gonna get a little deeper down into the trap and the levator in the back side here. And we're gonna just use a nice little finger pad contact with a little bit of lateral flexion to the right side, away from that left shoulder. And we're just going to start to push some of this swelling and fluid in the muscle downward. Oh. You tell me if this is too much, okay?
No, it's good.
You feel that thing right there?
Hurts great.
Hurts great, right? It's like that good pain. You've all felt that good pain where you're like, that stinks, but I know it's good for me, right? And every one of us in the whole entire world has little muscle inflammatory issues, little spots in the body that feel good when they get worked out. Look down for me. Helps to improve our mobility. If the neck's all tightened up, you can have lymphatic congestion, so stuff up in the head and the face and the throat can get all jammed up. You can have chronic congestion that doesn't go away, chronic sickness that doesn't go away. Look up, down, up, and down, up, and down. And so Dr. Emily, she's a little opposite of me. I got a big right side muscle nodule in my right shoulder. Dr. Emily's a little more on the left side today. Maybe just from the way she's been adjusting, maybe from stress. We still have a little click there, so we're gonna get that thing gone, okay? Get that thing out of there. Let's go face down on the table for me. All right, so one of the tools we use in the office is called Hypervolt, right? This is a really awesome vibration or percussion massage device. Helps us to save our hands a little bit, and helps the patient to get a little looser, feel a little better, and leave the office feeling and moving better, right? Feeling less pain. So we use the Hypervolt with all of our patients in the office. It's a great tool, and people love it. Some spots are ticklish, some spots are tender, some spots don't feel like anything. Generally, we want the healthy muscle, or muscle that is healthy, shouldn't feel pain, discomfort. Dr. Emily feels probably a little soreness up here, and maybe some ticklish down here, I don't know. Generally around the midsection, some of the muscle in that area becomes a little more sensitive. Definitely in the upper neck, we get some tension up there. And if you're a chiropractor, you're watching this video, you know, it's really important that you yourself also pay attention to your posture, that you're not all hunched over, and that we're working on a nice deep hip hinge stretch, elongating the spine and setting the shoulders down. All right, cool. Now we're gonna hit right hip a little bit, and we're gonna hit the left hip around the glute region, the upper glute region, kind of where the glute med, the glute min, the IT band are, or is over here. Just to provide some good movement down into her pelvis. Dr. Emily's probably going to sleep right now, right?
Yeah. I'm about to.
At the end of the week, when you've given all of your energy, or most of your energy, to patients and clients and work, we all do it, we all have jobs. Sometimes you have really energizing days, and other days are somewhat exhausting, right? So a little TLC at the end of the week is always a good thing. One of the cues that we give to patients and clients when you're having this done is to breathe deeply in and out of the abdomen. Same thing's true if you're getting a massage or any kind of body work done. It's important to breathe deeply, if you know how, down into your abdomen. And if you see Dr. Emily here breathing, she's got a great elevation of her lumbar spine, and her sacrum you can see is moving well as she breathes. Deep inhale, hold it in for about 2 seconds, 3 seconds, exhale it out nice and slow. Diaphragmatic breathing helps to reduce muscular tension throughout the body. It helps to keep your brain, her brain, in a nice calm state and just kind of zone out from all life stress. Cool. All right. So she's got a little bit of tension up in that left CT junction, thoracic spine. Deep breath in for me. Exhale out, shoulders open. Good, right there. Breath in and out. And breath in and out. And in and out. Good. Uh-oh. Relax this. Good. One more on the left side here. Good. All right. Face me over here. Deep inhale. Exhale out. Good. Other side. You're already nice and mobile. When did we adjust you last night, right?
Yeah.
Here. Boom. Deep inhale. Deep exhale. Good. Flat on back for me. Now we're going to switch around to up here. Good. Left. And right shoulder. Good. And then when you're done, you've got this little doodle right down here to say goodbye to. Downward dog. She knows what to do.
She knows it.
All right. See you guys later.